And good morning. It's noon, it's 12 o'clock, and that means it is time for Lunch and Learn with me, Dr. Polly Heil-Mealey at Abundant Health and Wellness, and we are located downtown Humble at 323 East Main Street. Did I say that already? Okay. Am I on? Do you see me?
I see you.
Can you hear me?
Yes, I can.
Am I right way up?
Yes, ma'am.
Oh, we're rocking it today. Okay, so today I want to talk to you about blood work. We have people that come in all the time, and I will ask them if they have blood work, and they just look at me like I'm strange because you're a naturopath, you're not a medical doctor. Well, that's right. I'm a naturopath, I'm not a medical doctor, but your blood work is very important, and you need to get a copy of your blood work when you go and get one from your doctor. Now, you paid for it, your insurance paid for it, so you deserve a copy. So please make sure, hey Nisi, thanks for joining. Make sure that you get a copy of your blood work because you need to know what your body is saying about you. Now, whether it's good, whether it's bad, we don't put a whole lot of, woe is me, I've got bad blood work. Your blood work is a snapshot in time of that moment. If you had your blood work done a week later, it could look totally different. But what we do here at the clinic is we get your blood work from the doctor, and it looks like this. And then we put it on a spreadsheet like this, and we track it to see how you are trending. Now, if you're healthy, I want you to be getting your blood work every year, every 2 years, okay? If you are suffering from some kind of sickness or disease, I want you to get your blood work every year at the bare minimum. Now, sometimes if you're already diabetic, they'll have you do your blood work every 90 days or maybe every 6 months. So what we want to do is look at that blood work, and we want to trend that blood work. Now, a lot of times when people come in with their blood work, I will ask them, well, what did your doctor say about this? And they say, well, my doctor didn't say anything about this. And I say, well, this is out of range, and this shows blah, 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 blah. And they'll go, well, my doctor never ever told me that. One of the things that I saw one time is we had a lady that came in, and she was in stage 4 kidney failure. And that's pretty bad. That's a pretty bad diagnosis. But also on that blood work, there was blood, blood in the stool. So blood in the stool is not a good sign. And it could be that it was just a hemorrhoid. It could be that it was nothing, but then again, it could be something else. So you really need to have that looked at. And so I asked her what her doctor said, and she said her doctor never mentioned it. And so this is the thing that I wanted to bring to your attention today, because a lot of times you need to know what your blood work is and what it says so that you can be very proactive in your health. So I wanted just to go over a few things with you in your blood work. There are some blood tests that I would like you to have that your doctor may or may not do. One thing that's very important is your pH test. Now that will come when you have, hey Beth, thanks for watching. That will show up if you have a urinalysis. Now, sometimes they don't do urinalysis. Sometimes they just do your blood chemistry, and then they do your metabolic panel. And so you might not have a urinalysis, but if you do have a urinalysis, we need to look at that pH. Your pH is really, really important. So why is your pH important? Well, your pH is important because cancer lives in an acidic body. So there's been a lot of hype on social media and different things about alkaline water, and you need to alkalinize your body and that kind of thing. And yes, you do. However, alkalinized body or an alkaline environment is a swamp environment. So nobody wants that, right? So your prime pH should be between 6.4 and 6.5. Your blood is going to always be at 7.3 to 7.4. So they don't usually check for your blood pH. Now, why should your blood always be 7.3, 7.4? Because 7 is neutral, and if your blood gets too far off from neutral, you will die. Because of that, the body has so many different safety mechanisms in there that your blood will probably never ever get too high unless you've got radiation poisoning or something like that, and then it can get out of line, and that's why you die. So your normal pH, we want it to be a 6.4, 6.5. I've never seen anybody come in with a pH that was 7, so that's a good thing. And I have rarely seen people come in with a pH that was 6.4 to 6.5. What I have seen a lot is people coming in with a pH of 5 or 5.5. Now, 5 is a very, very acidic constitution, and cancer will grow in that. So what causes your pH to be a 5? Well, your diet and your stress level. So if you're someone that goes out and you eat a lot of fast food, you eat a lot of processed food, or you don't eat, you drink pot after pot after pot of coffee all day, you drink sodas all day, that's the only thing you ever drink, that will really, really turn your body into an acidic environment. Cancer grows in an acidic environment. So we need to make sure that our environment is good, especially if you come and see me and you are a post-cancer survivor, right? We always want to look at that urine pH to make sure that it's in the right way. Now, why 6.4 to 6.5? Because that is when you absorb your minerals. So if you're taking minerals, you're buying supplements, you're taking them, you want to have the right pH so that your body can actually metabolize those minerals. So you could be someone who's very fastidious about your health, that you're doing this, you're doing that, you're doing the other, and you're buying all kinds of supplements, and yet when you come in and you have a urinalysis, your urinalysis is a 5 or a 5.5. You're just flushing those minerals down the toilet because you do not have the right pH to absorb them. So how do you get your body to be alkaline? Well, you eat a lot of fresh, raw fruits and vegetables, a lot of greens. I know, nobody likes greens, but they're good for you. Your mother was right. Popeye was right. Eat your spinach and you're going to be all good, okay? So you really want to alkalinize the body. Make sure that your pH is not a 5.5. You don't want it to be below 6, actually. So you want to make sure that that happens. Now, how do you test your pH? Well, we have little pH strips here in the clinic. They're not very expensive, and you can test your saliva or you can test your urine, and there's a little color-coded grid on the packet. I don't have one to hand, but there's a little color-coded grid on the packet, and you look and you match the color of your specimen to the pH number on the grid, and that'll tell you where you are. So if you are acidic, then you will have other conditions that will precede cancer. You'll have arthritis. Why will you have arthritis? Thank you, Trish. Here is the pH. I know it's backwards because we're on Facebook Live. But this is your little test strip, and these colors here tell you where you want to be. You don't want to be in the real blue because that's totally alkaline. You don't want to be in the really red either because that's totally acidic. But it's really easy. So test first and second urine of the day and record the average reading. To test, briefly place the pH strip in the urine stream, shake off the excess fluid, wait 15 seconds, and then read your pH. To test your saliva, which is my preferred method, just saying, because when you come in here, I don't want to have a stick that has urine on it. You wait 2 hours after eating. You spit saliva into a spoon and then dip your pH strip into the fluid, wait 15 seconds, and read your pH. So that's what we want to do. We want to do this. Now, if you don't wait 2 hours after you eat, you're going to have an acidic reading, and that won't be a true reading. So if your pH is acidic, then what the body's going to do is the body is going to rob the calcium from your bones. The calcium is going to fall out of solution and it's going to settle in the joints of your bone. And so you're going to create an acidic environment. if you have a low pH below 6, you're going to have a lot of inflammation. And that inflammation is going to cause things like rheumatoid arthritis to be worse. It's going to cause diabetes to be worse. It's going to be a real pain issue. So people that have autoimmune diseases that have a lot of pain, we want to get them out of acidity, because acidity brings pain. Stress makes you acid. Remember, a lot of soda, a lot of coffee, and that kind of thing, all of that makes you acid. So we don't want you acid. We want you to be more toward neutral, but we want you to be at that 6.5, 6.4. So that's something that you really want to look at. Another thing you want to look at is your vitamin D3. Now, on your blood work, I think they call it, they don't call it D3. Let me see what they call it. It's vitamin D, 25-OH. Yeah, that's what they call it. Dehydroxy something or another is what they call it on a different level. So on the reference range, it will say 30 to 100, right? 30 to 100 nanograms per deciliter. Now, we want it to be around 60 nanograms per deciliter. Why? Well, for a couple of reasons. One is you can't get cancer if your vitamin D is high enough. So that's just a huge incentive to do that. The second reason we want your D to be high is because you cannot get depressed if your vitamin D level is high. And then the third reason, I know I said I was going to give you 2, but I'm going to give you 3. The third reason is you cannot get the flu if your vitamin D level is high enough. So what we have here in the clinic is we have a vitamin D spray. It's a liposomal spray. You spray it right into your cheek. I think we're out, or I would show you one. But you spray it right into your cheek. Each spray is 1,000 international units. Now, healthy people, right? Healthy people need 9,000 international units in order to be healthy and in order to maintain your D level. So one of the things that I always ask the people that come in to see me is, what is your vitamin D level? And you know what? Almost nobody knows. And the doctors don't always do that on the blood work. So that's something that whenever your doctor says, I want to do blood work, you want to ask them, please, would you check my pH, and please, would you check my vitamin D level? Why? Because if you are acidic, your pH will tell us that, and we know that we have to get you out of that cancer environment. And if your vitamin D 3 is too low, then we know we're going to have some immune issues. And so we want to make sure that we deal with those. So those are 2 little clues that I wanted to give you today. Now, you'll go to the doctor. The doctor will tell you your vitamin D3 is low. And so they're going to give you a pill that is 50,000 international units, and they're going to tell you to take 1 per week. Right? It's a synthetic, it's a chemical, which we don't want to do synthetics and chemicals. But why do they give you such a high dosage? Well, because vitamin D has to go through digestion, through the liver, gets to the kidneys, and at that place is where the blood will absorb it and will take it to the rest of the body. So they give you 50,000 IUs because they know you're not going to get all that because you've got it chewed up in digestion. So what about those people that have poor digestion, right? They're not going to get anything because everything's going to be lost. Everything's going to be lost when it goes through the liver. So you're going to have some problems. With this liposomal spray, and we've talked about liposomes before, a liposome is an envelope, a lipid envelope, a fat envelope, and it takes the vitamin right to where it is biomarked, it is biotagged to go right where it needs to be in the body. So when you take 9 sprays of our vitamin D, then you're going to get 9,000 IUs delivered to the bloodstream. And what we've seen here is that our people who take the spray, they will double their vitamin D level in about 60 days. And so that's really, really important for you. So you've got some choices to make. You can go to the grocery store and you can get vitamin D off the shelf, which is going to be a very poor synthetic quality, and you're not going to know how much your body is absorbing because it passes through digestion and then it goes to the liver and gets chewed up there too. So what you want to do is you want to come in and get this good vitamin D spray. Now, we do live in the South here, and we do get a lot of vitamin D from our sunshine. In fact, that is the right way to do it. However, we're in the winter months now. A lot of us work, and the optimal time to get your vitamin D is between 10 a.m. and 2 p.m. in the afternoon. Now, most of us are working, so you may be able to take 20 minutes out of your lunch break and go outside. I don't know. When it's really, really hot and humid in our area, nobody wants to do that. So, hey, Angie, thanks for joining. Whenever you are taking the vitamin D spray, you know that you're getting exactly what you need, and we can actually track this on your blood work to make sure that you're getting what you need. So those are two little tips that I was telling you about. So another little tip I want you to look at is your GFR. Okay, on your blood work, you might have a little E with a capital GFR on there. And so what does that stand for? And I'm looking at this blood work. I'm trying to find it on the blood work. GFR stands for glomerular filtration rate. And that tells us what we need to do with our kidneys. And I know it's on here because I have seen it. Anyway, they've got a eGFR, and then they have non-African GFR because it's just a different reading. They've got different reference ranges. So what you want to do is you want to look at what your number is. You want your number to be over 60. We see a lot of people come in with their number is 100, 102, 98, that kind of thing. So anything over 60 is what we want to see. Now, sometimes we have people that come in and their GFR will be 60, 55, 40. We even have had people come in with their GFR, which is 30 something. Now, when it gets that low, that means you are having severe kidney distress. Now, we've got products here. We can make products. We've got all kinds of things for you. So we have seen people in stage 3 kidney failure, stage 4 kidney failure. We have seen them revive, and that's what we want to do. We want to make sure that you're looking at your blood work. We're seeing how your kidneys are functioning. I have a post-cancer survivor friend who her blood work is good. The doctors have said that she's cancer-free, but guess what? Her pH is not in the right place, and her GFR is in the 40s. And so I asked her, what did your doctor say about your GFR? And she said, didn't say anything. And it was like, well, I'm concerned about your GFR, because if your kidneys stop working, then we're in a world of hurt and we have to start dialysis and that kind of thing. So that's a little number that I want you to check and see where you are. The closer you are to 60, not in age, but on your numbers, you want to be above 60. You want to be well above 60. I want you to be in the hundreds or in the 90s. I don't want you to be at 70. I don't want you to be at 65, although you're still in a good place. But what we need to do is see what is happening to the kidneys. Now, your kidneys start to deteriorate after the time you are 30, right? So a lot of us want to live long and live strong, and so we need to make sure that our kidneys are doing what they need to do, and we have that GFR at a good level. So that's something that you want to check as well. There's another reading that I want you to check, and that is your glucose level and your A1C level. So what are those? Well, your glucose level, they want you to fast before you do a blood panel normally, and the fasting glucose is what that glucose means, and that tells us how much sugar is in your blood at that particular point. Now, that could be referencing what you had for dinner the night before, so we really want to make sure that you're fasting. You want to have, the reference range says that you want to have your glucose level below 100, which is right. If you have it 101, 103, we see this all the time, there will be a little mark on your blood work that says your glucose is too high. So what does that number really mean? Well, if you have blood glucose up to 120, right, that is still okay. Hi, Joy. Thanks for joining. That just means they're going to call you pre-diabetic. When your sugar gets over 140, they are going to call you a diabetic, and they're going to start putting you on medications to bring your sugar down. Now, a lot of processed foods, packaged foods, anything in a box, anything that's pre-made will have a lot of sugar in it. So that's why we want you to eat non-inflammatory foods, because we don't want you to have a high sugar reading on your blood work. So we want you on this test, we want you to have it under 99, but if you have 110, I'm not going to freak out. If you have 139, I'm probably going to freak out, because that just means that your diet's not good. We want your diet to be really, really good. Now, your A1C is a different blood test, and what that says, it measures your glucose over 90-day period. So if you are over 5.7, I think it is, they will determine that you are a diabetic, and they will start putting you on medications. Now, this is something that you need to know. Once you've been labeled a diabetic, they will never take that label off, even if we get your pancreas working properly. Why? Because in the medical field, they never see anybody get well or get healed of diabetes. And so, and I know this because I spoke to an endocrinologist. We had a young man, and he fought his wife when his wife made appointments for him to come and see me, and he wouldn't come and see me. And finally, and we did not know this, but the doctor said, the next time I see you, if your A1C is not lower, we're going to put you on insulin. Now, this guy had an A1C of 11.6. Tracy, 6 or 4? 11.6, 11.4? 11.4. So he finally made the appointment to come and see me. He had an A1C of 11.4. He did not believe, in fact, when I talked to him later, he said, I didn't think that you could do anything for me because I have the best specialists in the area. I've got the best endocrinologist. In fact, the head of the endocrinology department at that hospital was his doctor. And he said, I have two of the specialists. What could you know that they don't know? Well, I'm sure there's a lot that they know that I don't know. I know differently. Long story short, we put him on a protocol, and he didn't even follow the protocol the way I asked him to do it, right? But within 90 days, right, just short of 90 days, he went and had his blood work taken again, and the doctor came in and said, I looked at your blood work, and I think we have a mistake. And he went back to the nurse, and he said, I think you pulled the wrong blood work. And the nurse said, no, that's his blood work. And the doctor came in, and he said, this is absolutely phenomenal. He said, this is not the same blood work we saw 90 days ago. He said, what have you been doing? And the man was very kind of, I don't want to tell him what I've been doing because he might fuss at me because I went holistic instead of doing the medication. And the doctor, long story short, said, I need to meet this lady because she has done for you in 11 weeks what medical science could not do for you in 20 years. And so he actually, because he did come and he did listen and he did do what I said, not necessarily to the 100% that I wanted him to, but we actually got his blood work down in 11 weeks from 11.4 to 6.9. 6.9. We got his blood work down? Yeah, 6.9. The doctor said, the endocrinologist said, if we had waited a few more weeks, so we had a full 90 days, you would not be a diabetic. I know you are cured. Keep doing what she says, and I need her number because I want to take my family to see her. And so the guy did come in, and he brought all of his family, and so we started looking after his family. Now, this is the top endocrinologist at a renowned hospitals. So this is what holistic medicine can do for you. And he was very, very surprised that the blood work changed, because he said it just doesn't happen. Now, just going a little bit further down this pathway, when you are a diabetic and we get your pancreas working properly, let's say, and this has happened, we've actually had this happen, that people have been diabetic, they're doing dialysis, right? Because what happens if you're a diabetic for a long time, then you run into kidney failure. And so they're doing the dialysis. And there's a dry weight and there's a wet weight. Don't really want to go into all that with you, but they do the calculations, and once you reach a certain stage, they don't think that you're ever going to get better. And so once we get everything working properly, we get your pancreas working properly. Of course, we're treating you, working with you as a holistic individual, because you're more than just a pancreas. So we're working on those kidneys, trying to get that GFR up. And so what happens is the kidneys start working better, and there's less fluid to pull off during dialysis, but the dialysis technician doesn't believe you, won't listen to you. And so what they do is they pull off their however many pints or quarts or whatever it is, and then they've got to hook you up to an IV because they've pulled off too much fluid. So you've got to be very, very careful, and you need to be really honest with your doctors, and you need to be your own best advocate. So when we get things working the way they need to, then you've got to be your own best advocate, because what that tells the doctor or tells the technician is, yes, I know I'm supposed to be doing this, but my dry weight and my wet weight are the same. So there's no extra fluid. I'm processing my fluid the way I need to. Thanks, Carly. Appreciate that. So these are the things that we can do to help you. This is why your blood work is important. If you have an A1C that's over 5.6 or 5.7, whatever the bottom of the range is, you can correct it with diet. You can correct it with exercise. Don't feel like, oh my gosh, now I'm a diabetic and I have to be dependent on my medication all the time. You might need medication, but you can also heal your body. You are the person that is in charge of your body, and you can change with lifestyle, you can change with diet, you can change with getting toxic people out of your life. There are a lot of things that you can do to get yourself well. And so this is what I want for you, is I want to arm you with knowledge. I want to arm you with the questions to ask. Sometimes we've got blood work. Now this particular blood work, this particular panel, you can see we've done it in a spreadsheet, and it is actually 2 pages, and this blood work dates back to 2010. So there's a lot of stuff going on with this person. Now, there's your regular blood work, then there is lymphatic, what I call lymphatic blood work, where they look for seg bands and all that kind of thing. So when you're getting your blood work, if they have that much extra detail in there, what they're looking for is autoimmune disease. What they're looking for is incurable diseases. And so just be aware of what's on your blood work. I know we haven't covered a lot of this, but we've covered about all we have time for. So if you need to know more, or if you've got questions with your blood work and you want us to cover that, then let me know, and we'll be able to do this on another program. So I'm going to say goodbye for now, and I hope everybody is enjoying the weather. It's a little bit cooler out there today, and I hope that everybody's doing well, and you have a great weekend, and take care of yourself, and let us hear from you. Thanks so much.